Hey guys, welcome back. It's been a while since I've made a video, but today I wanted to kind of go over a story when I first started working at the clinic about 4 years ago, when a kiddo came in who was on a athletic department and there was the seniors hazed him. And one of the things they did was they made him and a couple other freshmen do push-ups to the point of exhaustion. And it actually turned out that it landed this kiddo in the emergency room and the ICU thereafter. And I kind of wanted to go over something called rhabdomyolysis, which really means muscle cell splitting, and how there's two main complications that could kill someone when this happens or make you really sick. Okay, so I kind of put this really bro-y looking shark here just to kind of remind you of, this kid was hazed. It's not cool at all. Most of the time, this would probably happen from, crush injuries or burn injuries, anything that disrupts the membrane of a muscle cell. But let's hop into it, okay? So here we have a muscle cell. You'll notice inside the muscle cell, the two main components we're going to talk about today is potassium, right? You've all heard of potassium. Bananas have a great source of it. Extremely important in your body, but it's found within your cells. It's an intracellular element. Here we have myoglobin. It kind of sounds like hemoglobin, but myo is the prefix for muscle, and it's a protein that helps bind oxygen for metabolism in your muscle cells, okay? But let's say you work out too hard and you start splitting a bunch of these muscle cells open. The membrane starts to tear open. There's a couple things that happens. The first thing is potassium, which should be inside your cell, right? That's why I drew it inside your cell. It leaks into the blood. And the biggest complication potassium has is it will travel to your heart and it leads to ventricular arrhythmias. Interestingly enough, lethal injection, right? If someone's on death row and you've got lethal injection, what are they giving people? Well, there's a cocktail with a couple things in it, but one of the thing that really kills individuals is potassium. Potassium causes arrhythmias. You go into something called ventricular fibrillation. You might have heard of like atrial fibrillation, like your grandparents are on like blood thinners for AFib is what you've heard of. Ventricular fibrillation is way more concerning because your ventricles are the bottom portion of your heart that does like 85% of your cardiac output. They're the big pumps. Fibrillation means they just quiver. So potassium, your heart is so sensitive to potassium that if there's too much, it literally just stops your heart. Okay, so potassium leaks out of your muscle cell, gets into your bloodstream, travels to the heart, affects the myocardium, specifically the ventricles, just like what happens with lethal injection, high amounts of potassium, and it could stop someone's heart, right? It's called an arrhythmia. Myoglobin is a large protein that should not be in your blood, but when it leaks out, it goes to your kidneys. Okay? You don't want to mess with your kidneys. Your kidneys are awesome. They're really just fantastic organs. However, myoglobin is large, it clogs up the blood supply, and it also spills into the urine. Right? So not only do you block the blood supply, you go into kidney damage. You could literally completely kill your kidneys. You go into kidney failure because you're not getting any oxygen, right? Because blood is important for delivering oxygen to tissues, but myoglobin is so big it literally blocks up the blood supply and it spills into your urine. So these individuals, like this kiddo that I saw, we did a urine test on him. It's really dark urine, like it's super gross. And then the treatment here is that really when these people are in like critical care or ICU, they just give them IV fluids. You're just going to give them fluids and you're going to sit there. I think this kid was in there for 2 weeks and you're just going to pee for 2 weeks to prevent the kidney from going into failure. So this is just kind of an interesting example of, hey, you got your muscle cell, but you worked out way too hard or something. You had a crush injury, a burn injury, anything that really disrupted the membrane that surrounds your muscle cells that keeps things in that should stay in, as opposed to them leaking out into the blood, wreaking havoc on your heart, Just like what happens with lethal injection, just remember they're giving a ton of potassium. That's what happens to people on death row. Potassium stops the heart, too much of it, like a lot of it. And myoglobin goes to the kidneys, plugs them up, stops oxygen from getting to them. They go into kidney failure. It gets excreted in the urine. You're given IV fluids for days to really keep these patients alive and make sure their kidney function comes back to normal.